Okay, so kinesiotaping the knee, right? Does it actually do anything? That's got to be the first question. And it's a valid question because it's like you're just putting some tape around the knee. Like there's not enough material or structure there to actually keep the knee from doing anything. And I mean, these are questions I've had. And so, but the other side of this equation is when we tape somebody's knee, their knee feels better, right? So why is that? And also it's like when people just put on like a knee sleeve, right? We've seen that before, like a neoprene knee sleeve. Same thing. I don't see it providing a lot of structural difference to the knee, but people's knees feel better. So today I want to talk to you a little bit about why your knee does feel better when it tapes, when you put some kinesio tape on it, and just briefly show you how to put some tape on. And it's pretty simple. So the reason that how I understand it, why your knee feels better with a sleeve or even some tape on it, is there's a lot of receptors in the ligaments, muscles, and muscle tendons in your body. And those receptors, and there's a variety of them, I'm not gonna name them all, give a lot of feedback to the brain as to what is going on in the joint. And pressure around the joint somehow gives your brain a little more feedback as to what's going on. And so that's sort of how the tape works, right? We know it's not providing any structural, structural difference to the knee, but it does feel better. And it's sort of just like, we ask patients like, hey, we'll tape your knee, and we'll ask them, did that help? And they're like, yeah, actually, after you put that on, like it did feel better, like when I was running or playing soccer or whatever. And so that's sort of how it works. It may be one of those things we don't completely understand even, but somehow some pressure through the skin, into the muscles, in the tendon around the joint make the knee feel better. So we actually recommend taping, if your knee has a little bit of discomfort, right, and putting some kinesio tape on. And so we use a really simple kinesio tape job here at Mission Move. And let me show it to you and give you a little advice on how to do it. We actually use the KT Tape Pro. I found that it seems to work the best. It's nicely broken up into pieces that are already a good length, okay? So the first thing you always have to do is clean the skin. So using just some alcohol on something to prep the skin just to clean it off is a good way of doing it, okay? So you would clean the whole area, and then what we're going to do is we're just going to put some tape on either side of the knee to sort of make it feel supported, and then we put one across the kneecap. And what that does is sort of helps to push some pressure into the kneecap down into the groove, and for whatever reason, that little bit of pressure keeps the kneecap more stable in the groove and feels better on most people. So the key with putting tape on, which there's a lot of videos on this, is to make sure that you don't stretch the middle of the tape. So it's basically like put the tape down, or you do stretch the middle of the tape. Put the tape down, not stretch to create an anchor, and then you're going to I've never actually really taped myself, so this will be interesting to do, but then you stretch the middle of the tape and then just lay it down like that. Okay, and then I'll have people do this with their knee mostly straight, maybe a little bit of bend in it, so that when they bend their knee, they'll get a little bit more pressure or more stretch on the tape. So again, lay the tape down first, then go ahead and stretch the middle of the tape. There you go, and just lay it down. And then just lay the end piece down too, just like you did the top piece, okay? So, and then kind of rub it like this. That helps the tape stick. And then the last piece, and sometimes this piece, depending on how big the person's leg is, these pre-cut pieces are a little big, so I won't stretch it very much. Again, lay it down, go right over the top of the kneecap, come over here to the other side, and then lay this side down. There you go. So that's pretty much all there is to it. Then have the patient bend the knee there just a little bit, and they usually like it. It feels pretty good. So if you have just a little bit of knee discomfort and you're wondering, does kinesio tape help? It does. It just makes you feel better. There's nothing wrong with that. So go ahead and get some kinesio tape, try it on your knee, and let us know what you think about it.